Well, it is the 370 something day of March 2020. What a year. My goodness, everyone has been through the ringer. Mental health wise, wow. I mean, if you went into this
Ooh,
feeling maybe okay, chances are coming out of it, you feel like you've been through the ringer. And if that's the case, well, there is something that you should know about mental health services available as simply as using your phone or using your laptop. It's available to you, and our next guest can help.
that's right. He is Dr. Anthony Quinn joining us today. He's the Chief Medical Officer with Behavioral Health Solutions. Welcome to the show, Dr. Quinn. Sean and I understand how vital, how important it is. People who never have been seeking therapy or treatment before, now is a great time. Tell us about how people reach you and book an appointment.
Yeah, definitely. First of all, thank you guys for having me. Really excited to talk about services and be of help to the community.
Mm.
There are several different pathways to receiving treatment. I know it can be very intimidating for a lot of people, especially if you've never done something like this before or you've heard horror stories about it.
Yeah.
But simply making a phone call, shooting an email over to the group. Some people show up to the office in person to establish care. So there are several different ways to reach out and get help. A lot of people will call their insurance plan directly
Mhm.
and receive referral lists.
Gotcha. There we go.
Hmm.
How soon? Obviously, when you're coming to the realization, you know what, I'm not going to be able to tough this one out. I need to talk to somebody and just kind of like take a breath. How soon from the moment you make contact to the moment you actually have that appointment? Are we waiting weeks, months?
Yeah, it depends on every individual's circumstance. So, some of the key indicators for receiving treatment or seeking treatment would be things such as having problems with your appetite, either really high or really low,
Yeah.
sleep problems, that could be oversleeping or not sleeping enough. Obviously, if you're having thoughts or urges to harm yourself or kill yourself or harm others,
Mhm.
and if for no other reason, you may have a little more time before to make a decision on where you want to go for care. But if anyone is having issues in the way of not being able to function like normal, and that could be at home, that could be in a school setting, work setting, or just spending time with family and loved ones.
Mhm.
Yeah, Dr. Quinn, this is some serious stuff. In your company, do you have psychiatry services available? And what designates like psychiatry treatment versus like therapy versus counseling? Maybe you could help break that down a little bit.
Yeah, that's a really good question. It can get a little confusing at times. At Behavioral Health Solutions, we offer both modalities. So there's psychiatry, med management, which some of the psychiatrists can also perform talk therapy or counseling services.
Mhm.
And then there's the other line of care on the therapy side, which would be psychotherapy or talk therapy. In most cases, those healthcare providers are not able to prescribe medications, and that therapy can take form on an individual basis, couples therapy, or even group therapy. The third thing I would like to mention is there are some options for substance abuse treatment, and that's both on the medication side and on the therapy side.
Excellent. Yeah,
Mhm.
I've been thinking about how this pandemic really came about and the timing. Because thank goodness, we've been able to do this show from home. The technology's been there. If this is 20 years ago,
Mm,
man, things would be way different. Thank goodness
mm.
for telehealth. This has helped you be able to keep in contact with your clients to be able to take care of them maybe from a distance.
Absolutely. One of the big things that I would like to stress is patient experience. So it's so important to find a good fit for your provider. And if we just talk about therapy, but mental health treatment in general, but especially therapy in most cases, it's not so important to consider solving problems or giving advice
Yeah.
as far as the provider goes. It's usually more so about finding the necessary tools to apply them to your specific circumstances to figure out what works best and remain consistent. And so,
Mhm.
what telehealth has allowed us to do is be able to easily access patients and clients, many times in the comfort of their home. So, you're not having to deal with traffic, you're not having to deal with a
Yes.
stuffy, crowded waiting room, and you can easily just pop on to either your laptop, your phone, or your tablet and access these services.
Fantastic.
Yeah, I think it's actually amazing how easy it is to connect with another human being over the phone. I've found that. Before we go, doctor, one more question, really quick. Just in terms of when is the right time to seek help? And obviously, you mentioned the seriousness of if you're having suicidal thoughts. We know that is a reality. And what about people who are just feeling really claustrophobic? What if they're having a lot of tension inside their home right now because they've been stuck inside with the family?
Yeah, absolutely. Anyone at any point, if you're feeling hopeless, if you're feeling helpless, if you're having a hard time following through on plans, and that could just be simply meeting up with family and friends.
Yeah.
It's always better to be proactive and take the preventative approach
Mhm.
to seek help sooner. And if you have more time before you find yourself in a crisis mode, it's better because, like I said, the fit is what's most important. Being able to work with someone that you feel like can understand your circumstances and be able to give you the right type of treatment that you deserve. Seeking help
Yep.
sooner rather than later gives you more time to hopefully find a better fit.
Dr. Quinn, great to have you, my friend.
Thank
Thank you
you.
guys so much.
All
Take
right.
care. Be safe.
You find yourself going through the motions, or maybe those motions are a little more than motions, you can go to the website you see right there on your screen, bhsnv.com. The number's there on your screen as well. They're at St. Rose Parkway in Henderson. Behavioral Health Solutions, a proud sponsor of the Morning Blend.